Right, part 3 is quite a big one. There's lots going on here, so I'm going to start in 1700 and then I'm going to run all the way up maybe to 1900, look at the liberal reforms. It'll probably be split into 2 or 3 parts, so be aware of that. Again, lots of new stuff coming in terms of government, centralised government, industrial revolution, so please be aware that this could take a little bit longer than maybe some of the other clips. Right, so Britain is one of the first countries, as we know, to go into the Industrial Revolution. Really important. So what do we get? We get better machinery, we get better understanding of things, we get loads of new houses, we get loads of new cities. Liverpool, Manchester, all places like that become really, really important. But actually what's happening is all of this is starting, and the legislation that is needed is not catching up with it. It's like you build a car without seatbelts. You put seatbelts in the car, then you go, oh, they go really fast, they crash. Maybe it should be a law that people wear seatbelts. Same with mobile phones. We had the mobile phone before we had the law. That's how life works. So in this case, as we get the Industrial Revolution, as we get the new towns and cities, we don't have the legislation that says build a house this way, have this green space, put a sewer in, do this. It just all spreads up at once. We've got the government who have what we call a laissez-faire attitude. Laissez-faire is great. It's a French word. It means leave it alone, don't interfere. The government, the MPs are often the rich people. They have what's called a vested interest. It's in their best interest to keep the businesses open because they're making money from those businesses. Therefore, they're not worried about the poorer people. Bigger the city, more people living together, more pollution. Drinking water, sewer water, essentially the same stuff in the 1800s, really bad. Factory waste goes into rivers. We get this arrival of a new disease in 1831 called cholera that makes its way into Britain, and that causes epidemics and panic. And a bit like the Renaissance, they're still burning those barrels of tar in the streets to ward off these miasmas, these bad smells. Where we really get into change is from 1848 onwards. 1848 is a pivotal year, if you like. It's the first time the government really takes action. 3 clips on there, and I need you to watch. If you're watching through this, type those in, have a look through, watch the clips, and then try and answer this question. Explain why towns and cities were actually unhealthy in the 19th century. That's the 1800s. Remember, chronology works like your birthdays. When you're born, you're 0. That is your first year of your life. Once you turn 1, you're in the second year of your life. And when we created this calendar, we started it as 0. So 19th century, 1800s. Have a look at those 3 clips. When you've had a look at those 3 clips, come back to this, have a go at this question. Put together a bit of an answer here for you. You can read through that. I'm not going to read it. But essentially what's happened is, in simple terms, is the government's not doing anything. Towns and cities have got bigger. Because towns and cities have got bigger, we've got more people living together. Those people living together are often younger people who have moved away from the countryside. People start to get married much earlier because of that. There's not the same sort of social control. There's a lot of particularly drunkenness and sexual behaviour. So we get a population explosion. The population explosion is happening quicker than the impact of things like epidemics of disease. So yes, by 1900, 140 out of every 1,000 babies aren't surviving, but thousands upon thousands of babies are being born, so that the population explodes. Some towns, some cities, those working conditions that poor. Liverpool has life expectancy for working men in teenage years. It's that bad. And what happens is, well, there's pressure on government. In 1832, they pass a Reform Act giving more people the right to vote. The more people that can vote, the more they want the government to do something for them. So the more pressure is put on the government. Towards the end of the 1800s, we get a group of very, very rich people who want to do something to help others. It's a bit like Bill Gates in the modern world. You'll notice during the current epidemic with the coronavirus that lots of rich people are donating money to help set up funds to help people. It's always been thus. And these people are called easy for me to say, philanthropists. Philanthropists want to give their own money to help others, and particularly people like Booth and Rowntree, and they'll be explained later on in this, are putting pressure on the government. If you're rich and powerful, you've probably got friends in the government anyway, and it's much easier to speak to them. You know, if I wanted to speak to Boris Johnson, quite difficult. If someone like Richard Branson or Alan Sugar wants to speak to Boris Johnson, much, much easier. But overall, what I'm putting my conclusion there is the pace of change, everything's happening really quickly, is happening much faster than the government either wants to or can keep up with it. Right, Chadwick. Edwin Chadwick is appointed as a government minister, and he's asked to look into why the population, particularly in London, is so unhealthy. This coincides with the introduction, or the final introduction, of income tax. Income tax is something we all pay, and we pay about 25%, most of us. It goes up if you earn more, but essentially income tax in Britain had always been a temporary thing. It was only introduced to pay for wars and times of national emergency. The last time it was introduced in 1841, and then it becomes permanent. So Chadwick, they've got now more taxpayers, more pressure on the government to help. Chadwick he writes a report. It's called the Report on the Sanitary Condition of the Labouring Population of Great Britain, which really means a report on why poor people are unhealthy. And it's quite revolutionary, because what he says for the first time is it's actually sickness that causes poverty. It's not lazy people. It's not people who can't bother to work. They get sick. Because they're sick, they can't work. Because they can't work, they don't get paid. Because they don't get paid, they can't go to the doctors. They become more sick, and you get trapped in this cycle where you just cannot do anything to get out of it. There's no unemployment benefit at this stage. There's no old age pension. So if you're not working, you're not getting paid. Chadwick occasionally isn't very popular because he becomes a really big supporter of preventative medicine. He says, if we can get in and stop it spreading and ease the tension at the start, it won't be a problem later on. Which is sensible, but not liked by doctors at the time, because doctors at the time get paid by how many patients they see. So they need people to be ill in order to get paid. And Chadwick starts this debate in Parliament between people who want to clean up cities and people who don't. Sometimes you can split it really easily into the Conservative Party and the Liberal Party. There are only two political parties here. But not always. And so you get their nicknames, Clean and Dirty Pie. But remember, we go back to the point the government would have a laissez-faire attitude. They don't want to interfere. They want to let nature take its course. We then get big epidemics caused by overcrowding in the streets, caused by back-to-back terraced housing, caused by houses being too close together, and cholera reaches Britain in 1831. The first official victim of cholera is called Williamsborough. By 1832, it's caused 21,000 deaths in London alone. So temporary measures are put in place to deal with it. And other outbreaks, we've got smallpox up until 1853 when the vaccine becomes compulsory. Typhus and typhoid, which kills Prince Albert, the husband of Queen Victoria. Tuberculosis, that condition of the lungs we can't get rid of. And so what's actually pushed through Parliament is the 1848 Public Health Act, the first big public health act of its kind in Britain. The 1848 Public Health Act is essentially rubbish, but it's a starting point. It's the government are now taking action to change things. It sets up a central board of health in London, a temporary board. It's only there for 6 years and then gets closed down. If 10% of your taxpayers in your town wanted it, they could set up their own health boards. But none of the act was actually compulsory. Like I say, it's a rubbish piece of legislation. And so only 182 towns and cities in England set up their own health board. And it's not just about the government. People don't want the government interfering in their lives. They don't want the government making laws which control them. You will see that in the modern world with people when they react to government measures and say, oh, this is the government being too controlling. Think about social distancing and think about the lockdown England is in at the moment due to the coronavirus, and you get a really good idea of how we react to the government taking control of our lives. Chadwick himself, because he was argumentative, because he was rude, upset too many people, and he kind of got the sack essentially. They gave him a pension and wrote him off. And then of course we get cholera comes back in 1854 and the government is forced to act again. Around about the time of the second cholera outbreak, you've got John Snow. Now, John Snow, you remember, chloroform, gave it to Queen Victoria, really important. But what it also does, because he does empirical research, he studies the area where cholera is really, really bad. And he works out that most people dying of cholera in this particular area get their water from the same water pump. to convince people this is a problem, he disables the water pump. He basically steals the handle from it, and this disables the water pump, meaning that people have to get their water from elsewhere, and people suddenly get a significant drop in the cases of cholera. Hence, what he's done is prove that cholera is a waterborne disease. Now, he can't explain why, because it's a couple more years till germ theory actually reaches Britain. But when Pasteur's work in 1861 and then 1864 is published, it reaches Britain, it's translated, and we all go, John Snow was right. So Chadwick gets the sack, replaced by a guy called John Simon. Simon had previously been a surgeon, so we move away from prevention because we move more for treatment as being a surgeon. And in 1869, he sets up something called the Royal Sanitary Commission, which says all towns and cities in England should have clean water. Then in 1872, we pass another Public Health Act, which creates sanitary areas. In 1875, we pass another Public Health Act, which gives us things like street lighting. There's a Rivers and Pollution Act of 1875, and my personal favourite, the Food and Drugs Act, which, for example, bans the dyeing of meat, so you can't make it look fresh as it is. So by 1875, the government are taking action. I don't know, sorry, I'm flitting around in time a little bit here, but that's kind of how it has to work. Joseph Bazalgette becomes really important. In 1858, we get a really long, hot summer, hot enough to dry up most of the River Thames. And what happens is it stinks because all the sewage is in there. It stinks that bad they have to close down Parliament. Now, Bazalgette has already presented Parliament with a plan to build proper sewers under London, but they don't want to pay for it until the Great Stink, and then they give him £3 million to do that. He uses 318 million bricks, and he designed these bricks himself, and they're kind of water and sewage resistant. It takes till 1870 to build the sewers, but those sewers that are underneath London are the sewers that Bazalgette built between 1858 and 1870. They're now coping with millions more people than they were ever designed for. If you get a chance, they're not on any of these videos here, but look at those things called fatbergs, where we pour oil and cotton buds and all that stuff gathered in sewers down here. People have to go down and smash them up, really important. But this, after 1870, no more cholera outbreaks in London. The sewers have done the job. This can be rolled out across other towns and cities, hence the 1875 Public Health Acts. Here you go, a summary of the 1875 legislation. I've talked about that already. Street lighting, clean water, the Artisans Dwelling Act, which allows people to buy up these back-to-back terraced houses, knock them down, put in new streets. Again, that's not popular because they're kicking people out of their homes. Why they knock them down and build new ones? Rivers and Pollution Act try to stop us chucking stuff in the rivers, and the Food and Drugs Act. The Food and Drugs Act also says you can't patent your own medicine anymore. You can't make your own medicine.